Thanks for staying with us here on Sunrise. If you're just joining us, thanks for coming along. Well, cardiology and infectious disease are often seen as two very separate constructs within medicine, but often we're hard-pressed to find cardiologists with a specific interest in infectious disease. Well, CEO and lead cardiologist at Partners Heart and Health, Dr. Victor Elliot, he joins us this morning to tell us about when cardiology meets infectious disease. Welcome, Dr. Elliot. How are you?
Hi, good morning. I am well, and morning to the listeners.
All right, so, I mean, cardiology, that speaks to heart health,
Yes.
and infectious disease, all the twain meet.
All right, so yes, we are actually having a webinar to discuss this on Sunday. And the topics that we're looking on, and just to quickly explain, well, let's start with a common one, COVID. When COVID was around, everybody was talking about COVID and the heart, myocarditis.
Yes.
So we are going to have one of our graduates and our international infectious disease specialist talking about COVID myocarditis. Where are we now, 5 years after? What have we learned? What is the truth from what is not the truth? Because viral infections like COVID can affect the heart and can
Even
lead to
long
heart
after.
failure, even long after.
Right.
So that's one of the topics, and that's a point where we meet. A very common one in Jamaica is what we call rheumatic heart disease.
Yes.
You always hear us talk about rheumatic fever, never ignore a child with a sore throat. And that's because that germ which causes rheumatic fever, when your body mounts an immune response to it, that immune response can affect the heart, causing valvular disease. And it is actually one of the most common causes of problems affecting the valves of the heart. So we want to give updated information on that, new treatment modalities, some which no longer involve surgery and some which don't involve surgery, and also prevention and how to prevent any infection of the heart. Especially dentists are well tuned to this. They want to know, is your heart okay before we do any dental work?
That's true.
Because a lot of
They check your
times,
pressure.
depending on the dental work, those germs can get down and affect the heart, causing what we call infective endocarditis. And so we're going to talk about that. No big word.
No, it's even when you just said it, Doc, it's like
It sounds serious.
It's serious. It's like it's a lot. It's going to the ventricles. I was like, oh my God. Oh my Lord. And you know, Doc, so I'm happy we're talking about this because many times people hear about cardiology or heart failure or heart problems and take it lightly, right? And so this is something that we have to on which we have to focus and take preventative measures. So just for the purposes of our viewers, generally speaking, okay, a hurricane is upon us, right? And I know that persons with heart problems are also worried because you may not be able to get to a hospital in time or be able to get help in time. So how can persons who may have family members with heart problems or they have heart problems, how can they be prepared for a hurricane that's, you know, imminent?
And I'm glad you have asked that because preparing yourself medically, we always hear how to prepare your house, put away your documents and so on. But how do you prepare medically? Well, this is my preparation bag.
Okay.
So I am prepared for when the hurricane comes. I have my medication already packed away in a sealed container to keep it dry. This is the tablets I take. So it's already packed away. So if the bag gets wet, my medication is dry.
Nice.
You have to think about that. You always have to make sure you have things to keep, if you get a cut, to keep things clean. This is hydrogen peroxide. Some people can use alcohol. You want, because if you prevent any skin infection, you can help to prevent infective endocarditis. But let's go a little bit beyond the heart. You also have to just make sure you have your little kit, your diabetics. Make sure you have your syringes and needles in a nice dry container.
And your insulin.
And your insulin now, which you have to keep cool. Now, you may need to have an ice pack, start freezing it from now. Or you may have to get one of these things, you know, which can hold things cold for a while, put some ice in it from now. So if you have to evacuate your house, just get your insulin in the container and you can run, and that will keep keep your insulin cold for the next few days because you may be in a shelter or you may not even have light. So if you have at home an igloo, get some ice from today to just in case. And strange enough, I also have my cotton wool and my blanket wrapped up to keep dry, because even though it's going to be hot after a hurricane, if you have gotten wet, getting cold, what we call hypothermia, is a major killer of persons. So pack your blanket, keep it warm, keep it dry so that you're safe. And a warning about your medication. A lot of people feel, oh my gosh, I haven't eaten, I cannot take my medication, my blood pressure medication, my heart medication, my diabetic medication. Read the labels properly. Most of them you can take, even if your stomach is empty. And for those which you cannot take on an empty stomach, pack a little package of, say, crackers or 2 bits of dry bun or a little piece of bullock. Because all you need is a little bit of food in the stomach to take those medications which you need to eat with. So pack all of those in a bag which you can take and run when you have to go to the shelter.
Boy, Doc, I love that.
Wow.
Where can we tune in, Doc, to the Zoom or
to the webinar?
How does that work?
The webinar, you can find information about the webinar at our website, www.pic-jm.com. You'll find a link to the webinar, and you can also call, make sure I get this number right, 579-248. 579-248 to get more information. And it is mainly for medical practitioners, nurses, pharmacists, dentists, but we know there are people in the public looking after people who have rheumatic heart disease, who have had COVID problems. We're also looking on HIV and the heart, because that virus also affects the heart. So you can tune in and learn a lot more where cardiology meets infectious diseases.
Just a moment. The number, you had one of the numbers missing. 579-9248. The one, you had 2 nines.
Oh, you know it, so.
I was just saying
579-9248.
And that also hypertension and the heart as well, because many Jamaicans suffer from hypertension, and I'm quite sure that may have some effect on the heart.
Absolutely, and that itself is a whole nother topic.
Yes, it is.
But at this point in time, in preparation for the hurricane, again, make sure your medication is packed away. Don't let the anxiety make you not take your hypertensive medication, because here's a fact. During hurricanes, things like heart attacks occur more often. And one of the reasons is that the anxiety pushes people's blood pressures up. They forget to take their medications, and the high pressure puts you at risk of having a stroke or a heart attack. Let us not make that happen.
All right.
Good
Thank you very much.
I love that. Thank you, Doc.
Absolutely.
Bless, sir.
Good, very, very good.
Of knowledge.
Yes.
I like you,
I didn't care just really talk.
Yeah, that's kind of know him job.
Talk to Doc, man. All right.
Yeah, he ready it.
I did pass my comment.
I know.
In the days.
Yes.
Our guest has been Dr. Victor Elliot, CEO and lead cardiologist at Partners Health, Heart and Health. On the other side of the break, we're going to step out of the world of health and into the world of tech. It's a masterclass in AI. We'll be right back.